Welcome. My guest is Dr. Paul Serrano of Arizona Sleep Apnea Solutions. Today on the program, we're going to be discussing how to tell if your child has a sleep disorder. And Dr. Serrano, thanks for joining us.
Hi, how you doing?
Let's start with why a parent you think should be concerned if their child does have some kind of sleep disorder.
Well, it's a common known fact these days that if you snore as a child, you're going to be more apt to have disease processes as an adult. It shows up more in growth and development when you snore or are obstructed as a young patient.
Dr. Serrano, if I'm concerned about my child having a sleep disorder, what kind of symptoms should I look for?
Well, there's some symptoms that wouldn't be really related as you would just think intuitively, but there's a high incidence of ADHD, kids diagnosis with sleep apnea diagnosis. There's a high incidence of obesity. IQ levels have been shown to be decreased in kids that have a history of sleep apnea and sleep disordered breathing.
Dr. Serrano, can you talk about some of the main causes of sleep disorders in children?
The most common cause of sleep disordered breathing in children is an obstructed airway. That can come from a couple different reasons. One of them predominantly is increased adenoid tonsils, where the tonsils obstruct the airway. Another one is the overbite in a small lower jaw. And when you have a small lower jaw, it decreases the airway and kids will obstruct and snore. There's no normal snoring in children. If a child snores, it's pathologic.
Now, if I think my child does have a sleep disorder, what's the first step?
Well, I think the first thing is get to a place they can be screened properly. These days, us orthodontists are very trained in looking at the craniofacial form, that's the size of the facial features, but also looking down the throat to see what issues there are there. Taking a good medical and dental history is key.
Well, once a child is diagnosed with a sleep disorder, what are some of the treatment options?
The treatment options these days include things as complicated as getting your tonsils and adenoids removed, all the way to a simple appliance that basically protrudes the lower jaw and improves the airway, and at the same time improves the occlusion, quote, the bite, and the way kids eat and chew and thrive.
Well, Dr. Serrano, it's been a great pleasure. Before we close this out, can you give us some tips on just helping kids sleep better?
The practical tips are really twofold. One of them is to make sure the environment that they're sleeping in is normal, but the other thing is to make sure that they can breathe at night, that they're not obstructing, they're not snoring, and they get assessed and screened for that, and then treated.
Dr. Serrano, thank you.
Well, it's my pleasure. I hope we can help some of these kids. I think it's very, very important.
My guest has been Dr. Paul Serrano of Arizona Sleep Apnea Solutions. I'm Scott Drake. Thanks for watching.